Good day everyone, I'm Marcel Santos from BSN 1B, and for today's video, I will demonstrate the assessment for the respiration. The first thing that we'll have to do is to assess the patient. We have to consider the following: the skin and mucous membrane color, the position assumed for breathing, signs of cerebral anoxia such as difficulty in speaking, feeling dizzy, inability to concentrate, memory loss, headache, difficulty in walking, and we also need to consider the chest movement, activity tolerance, chest pain, dyspnea, and the medications affecting the respiratory rate. Next, the equipment for this is watch with the secondary indicator. Then you'll have to introduce your name, speak with the client of what you're going to do, why it is necessary, and how the client can cooperate. So, hi ma'am, I am Maricel Santos. I am here to assess your respiration. I just need to check if there's any problem. So if there is, we can prevent it as much as possible. I'll have to ask few questions and you just need to answer it honestly. Is that a great deal, ma'am?
What?
Is that a great deal?
Okay.
So to verify the client's identity, we'll have to ask the name and age of the patient. Ma'am, what's your name po?
Rosalinda Santos,
And your age po, please?
74.
Thank you so much. We need to always perform hand hygiene before performing any procedure. It's either you wash your hands or put an alcohol. As long as it is 70%, it's your choice. As long as it is clean before the procedure. So to provide for the client's privacy, you can close the curtain. If the patient is changing the gown, you can ask the patient if they want you to help them, if they want you to leave, or if your patient has the opposite sex as yours, you can ask someone with the same opposite as your client to stay inside the room while you're doing the assessment so the client would feel comfortable. Then let's observe or palpate and count the respiratory rate of my patient. If you anticipate the client's awareness of respiratory assessment, place a hand against the client's chest. So let's place the client's arm across the chest while taking the radial pulse. Let's locate the radial pulse. We have to count the respiratory rate for 30 seconds and 60 if it is irregular. An inhalation exhalation can count as one respiration. We will now count the respiratory of the patient. You can look above the clock up here so that we can observe it both. Okay, let's start at 12. So 32. Then let's observe the depth, rhythm, and character respiration by watching the movement of the chest, regular or irregular rhythm, the sound they produce, and the effort they require. Lastly, we have to document the client's finding on the client's data. That's all. Thank you very much for watching.